Is a board certified ER doctor in LA. He studied global health at Georgetown University, medical degree from Ben Gurion University, completed his residency training in emergency medicine at Lincoln Medical Center in the South Bronx. He's the real thing. He's also a former United States Peace Corps volunteer. So grateful for his generosity and spending time with us every couple of weeks. He's a real doc. Michael Daignault. What's up, Dr. Daignault?
Hey, good morning. I just noticed on that the intro to Vital Signs, you have that quote from Trump talking about using the
Yeah.
UV light to get rid of COVID back. Man, that really brought back some memories of those
Yeah.
press conferences.
Well, it's a two-step process. It's the light and then the bleach. And when you put those two together, maybe you get some results. I think
Magic.
they're researching that now. I mean, it sounds like quackery, but the quackery that's coming out of the RFK Jr. CDC and NIH directed agencies now may rival some of that. But it's kind of it doesn't play as absurd because it's got a lot of podcasters talking about it and a lot of alternative medicine people pointing to it. And alternative medicine, I think you would agree, doctor, can be a welcome part of therapies and of good health, but it has to be responsible alternative medicine. It can't be quackery. I wonder if you can speak to sort of some of what's going on now at the federal level when it comes to everything from health guidance to vaccine guidance, et cetera.
Yeah, I mean, where do we start? I feel like every day I wake up and I check the headlines and I just like I don't know where to begin. I guess we could probably, I think the main thing to start with is what's been going on with like updated COVID vaccines. And you and I talked offline last night about some of these tweets that are going out from RFK, and then the response from some of the, Make America Healthy Again, the MAGA, the zealots that are basically not happy with RFK, which is just interesting to see the divisions within that camp. And so the major news at the end of May was, even without, they still don't have a CDC director. There was a video where it was RFK, the director of the FDA, and the NIH director. They made this video where they basically announced that they're no longer recommending updated COVID vaccines for healthy people, particularly healthy children, and also for pregnant women. And the thing that's most concerning about that is when you're pregnant, you're in an immune compromised state. And pregnant women are at very high risk for severe COVID illness just because of the state of being pregnancy. You're more likely to have blood clots. You're more likely to have bad things go wrong. And we've seen in multiple research studies that pregnant women have a higher rate of complications from COVID if they're not vaccinated. And so the big question around this was, if they're limiting access and they're saying we're no longer recommending vaccines for these groups, can you still get them? And so the answer is unclear. In theory, you should still be able to get vaccinated if you want an updated COVID vaccine, but because they're no longer recommended, you're going to have insurance companies sort of step back, and they might not pay for it. And so for those, particular people, low income, minorities, those are the ones that have had most severe COVID illness. It's going to be more difficult for them to get vaccinated. And so here's a tweet that you and I were discussing yesterday. So he's addressing the MAGA zealots that were a big proponent of getting him into this position. And I want to just go through this tweet because
So this, and by the way, we talk about tweets, but this is an official post
yeah.
from the from RFK Jr., who is the Secretary of Health and Human Services. So this isn't just some guy.
No,
Again, this is an official government position. Go ahead. Sorry, doctor.
no problem. And this was June 3rd. So this was 3 days ago. And he's addressing, everybody. So the zealots in the MAGA Maha movement wanted mRNA vaccines to be completely removed from any kind of government recommendation, no longer used, etc. And so what he's saying here is that he's asking for Moderna to do another placebo-controlled trial of the updated COVID vaccine. And so the main issue with that is, back in 2020, we already did this. We had over 100,000 participants in multiple research studies from Moderna, Pfizer, and Johnson & Johnson. It was a double-blind, randomized controlled trial that showed that the vaccine was effective in reducing severe disease, reducing illness in general at the very beginning of the pandemic. And so basically, when you're asking for another placebo-controlled trial, it sounds like science. It sounds like he's promoting, evidence-based science, but basically this is just pushing things further off into the future. And so when you already, whether you have a new drug, a new cancer treatment, or a new vaccine, when you do a placebo-controlled trial, one group is going to get the placebo, and then one group is going to get the intervention, whether that's the drug or the vaccine, etc. And the ethical concern is that when you already have a proven vaccine and you're studying it in high risk populations, part of that high risk population in the study group is going to get the placebo and not the vaccine, and that's going to put them at risk. And that's a major ethical concern when you already have a proven vaccine.
Yeah, we've already done this dance, and now you're saying you want to do it
Already done it.
again, and the placebo control group are being cheated essentially out of a legitimate vaccine. I want to
Yep.
just read the tweet because for those just listening, because we're on Spotify and Apple Podcasts, etc., and are just hearing it. This again is from RFK Jr., the Secretary of Health and Human Services. I'll just read it quickly. I want to address those of you who have anxieties about U.S. FDA's limited approval of a new mRNA COVID vaccine for high-risk populations. Moderna has agreed to a true placebo-controlled trial of the new vaccine, which is similar to the existing mRNA vaccine, but uses a smaller protein. I want to come back to that in a second. But you talked about the placebo and the fact that we've already been through this. The FDA will monitor and collect data throughout the trial for every adverse outcome, not just a table list of expected outcomes. FDA will scrutinize every aspect of the trial. We will deliver on our promise to use gold standard science and common sense. You would say, hey, we already did use gold standard science and common sense. But let me ask you about this smaller protein thing. He does a lot of this where he'll make a big pronouncement. We're going to do placebo-controlled. We're going to check every adverse outcome, sort of suggesting that every adverse outcome wasn't tracked prior to this. But then he throws in a little nugget of what seems like science if you don't know. So we're going to use the existing mRNA is what he says, but using a smaller protein. What does that mean? How does that change the vaccine? Does it make it more palatable for the body? Tell me why he throws that in.
So you're 100% right. I mean, this is the playbook, right? Like you use this tweet that's full of, science jargon. It sounds legit. Like if you were just scrolling and you read this, everything in this sounds good. So regarding the smaller protein, I did some research last night. There's nothing in this new placebo-controlled trial or the updated Moderna vaccine that said they're using a smaller amount. This is totally not true. And I think what he's trying to do is saying that there's less mRNA in this new vaccine that they're doing to sort of like, give the people what they want essentially. But this goes back to their whole fear of mRNA. And I sent you another tweet last night, and it's mind blowing that you're seeing some of these doctors out there, like Dr. Emmanuel, since the beginning has been very anti-vax. I'm surprised she still has a license, but she promotes products that they're basically snake oil that promise to eliminate all mRNA from your body. And it's mind blowing because if you remember from like high school biology, mRNA is in all our cells. Like mRNA takes the genetic material that's passed down to us in our DNA and it codes for proteins for every part of our body that we need. And so it's become this anti-COVID vax, but particularly anti-mRNA
Yeah,
whole spiel.
that's her tweet. Not to interrupt, but I just want to kind of put it
Right.
in context again for people who might just be listening. Dr. Stella Emanuel, MD, this is the person to whom Dr. Daignault is referring, tweets this: mRNA needs to be taken off the market entirely, in capital letters with an exclamation point. And that was her
Mind blowing.
remark about the statement that Secretary Kennedy had just posted, the one that I read you before, the one about we're going to have a new vaccine, it's going to have a smaller protein, but going to have mRNA. But she's saying, hey, mRNA needs to be taken off the market entirely. I mean, she cranks it up a notch, you know.
Yeah.
Um, and this mRNA technology during COVID, we were reading about how revolutionary it was, that it could
Mhm.
be repurposed for the COVID problem from a lot of the ways in which it was being used. It was even being applied to, I thought, some cancer research, as I
Mhm.
recall at the time.
Yeah, I mean, the benefit of the mRNA technology platform. So, just to give the listeners and the viewers just a quick, one-liner about how mRNA vaccines work is that you use a small mRNA is very small, and basically, when you have it injected into your body, your immune system translates that mRNA into the spike protein that COVID uses to get into our bodies, and then that subsequently generates an immune response, creates antibodies so that in the future, when you're exposed to COVID, you're able to fight it off. The advantage of this compared to other vaccine technology is that the scientists can quickly update it as variants change. And that's, not just COVID, that's potentially bird flu, which I'm sure we'll
Which
talk
we'll get
about,
to, yeah.
and any variant. And that's what they've been doing every season. They look and see what the most prevalent strain is, and they update the mRNA platform technology to create a newer vaccine, and they're able to mass produce it very quickly. And that's just been an amazing part of science. And as you mentioned with cancer too, they can basically target treatment using the mRNA technology specific to that person's tumors that are causing their cancer. And so, unfortunately, when you have such a backlash against the mRNA vaccine and mRNA technology, we're really losing a great opportunity here to develop novel treatments against cancer and be more prepared against additional pandemics in the future.
Yeah, it really feels as though we're backsliding in terms of where the
Mhm.
science is. This is
Going backwards.
a real war on science. Um,
Mhm.
and just to be clear, the mRNA technology is not the kind of vaccine technology that's used in the flu vaccine.
Right. Yeah. The traditional, flu vaccine uses a whole dead inactivated virus. And so your body, the immune system is exposed to that when you're vaccinated and is able to generate the protection from that.
And a quick follow up on that. And the only reason that we don't use the dead virus for COVID, for example, is because the mutations are such that the dead virus would not really help you with. Is that the point of the mRNA? It wouldn't be able to help you in targeting the new mutation of
Well,
COVID?
just remember though that the J&J, the Johnson and Johnson vaccine did not use mRNA technology. They used a more traditional approach. But again,
There were issues with Johnson and Johnson or not?
they not there were. It just takes a longer time to develop an update, basically, compared to like the mRNA from Pfizer and Moderna, for
So
example.
you saw both of those vaccines as, that is to say, both those technologies, Johnson and Johnson, Moderna, et cetera, as being uh, both well suited to take on COVID.
Yeah, but I think like subsequent studies showed that the Pfizer and the Moderna were just a little bit more effective, particularly at the beginning of COVID when we had the original strain.
Mhm.
They showed more, a higher rate. It was in the upper 90s protection against severe illness and stuff.
I'm
So,
going to move past COVID here, but this is my last question on COVID because we did get it from a listener. It was, let me just find the exact wording because I had asked listeners and viewers to, who had specific questions for you. This is from Donna. She says, I'm 64 and I've had 5 vaccines to get before the end of the year:
mhm.
COVID, flu, shingles, 2 shots, of course, of shingles, and a measles booster because the blood test confirmed I'm not 100% immune. Went to my pharmacist today and asked about all of them and the timeline between each. She told me that they were told to send all the COVID vax back, but gave no reason why, and they do not know if or when they will get any back. Please ask the doctor if he knows anything about this.
Yeah, this is concerning. This is what we were saying that as much as RFK pledged during his confirmation hearings to not limit access, this is exactly what they're doing. And so if you go on the CDC webpage for COVID vaccines, like right now, it still has from the Biden era, it still says everybody 6 months or older recommended to be vaccinated. And then at the top, there's a banner that says new guidelines are coming. And so there's a CDC ACIP. That's the committee of doctors that they have. It's a meeting June 25th to 27th. So that'll be really interesting to see, because the recommendations come from that committee, never from the HHS secretary. But again, we don't have a CDC director right now. So they had canceled the previous ACIP meeting a couple months ago. So we'll see what happens when this group meets this time and what new recommendations they're going to have going forward, because that determines what happens at your local pharmacy. Like that
Wow.
determines what vaccines are going to be available. So to answer the viewer's question, I mean, I think focus right now on updating the measles vaccine, especially, because there are a lot more measles cases going around, and if you're not immune anymore, the 2 shingles doses are important. But my concern is, again, every summer we've seen a COVID surge. Like, it's been weird, right? Like, you have the winter surge and then you have the summer one. And in the ER right now, certainly in the last week, seeing a lot more people testing positive for COVID again. And so, the only vaccine that's available right now, if you can find it, is the previous winters, or almost like the one from last fall. So it probably does provide some protection, but it's not as closely matched as we would want it.
All right. Now to bird flu. Bird flu is something that seems to take the headline, then fade, then take another headline, then fade. So it's not in the public consciousness a lot, or in the public conversation a lot. And of course, it gets bumped out by a lot of other stuff that's going on. I mean, Washington is something of a circus right now, and the circus, unfortunately, is destructive. It's not a playful circus. But my point is simply, in the news cycle, bird flu has been bumped out unless you're really following it. So you, in the medical profession, you and your colleagues really do follow the progression of bird flu, the threat of bird flu. I wonder if you can just update us on where that stands.
Right. So this is something that you and I are certainly have been following. And so I think the big news from bird flu, again, going back to mRNA, was that RFK canceled Moderna's bird flu vaccine contract. And that was an mRNA vaccine platform. Again, they had already been in human trials, which showed that the bird flu vaccine was very effective. There was no concerning like safety profile or interaction side effects or anything like that. So it was moving forward, and that was going to be really important to have, just so we could quickly, update it depending on if bird flu subsequently mutated to the point where it was passing from person to person. The existing stockpile of bird flu vaccines that we have are more like the traditional flu vaccine, and so they may not be as relevant anymore, updated to what the current strain could potentially be. And again, that goes back to how great the mRNA vaccine platform is for quickly updating. And so that's a huge setback. I feel like we're just sort of flying blind right now, and we're not going to be prepared. And that was it was like a $700 million contract with Moderna. And the fact that they were already through clinical trials with safety and efficacy, and then to just lose that progress is not good.
If people can't get the boosters, is coming in the chat, and the vax wears off, will we be seeing more people dying of COVID? We just kind of explained that maybe there'll be a vulnerability to bird flu because of the KOing of that whole program. I mean, it's just been knocked out. But I'm wondering about, and based on this comment, if people can't get COVID boosters, might there be more death from COVID?
Yeah, I mean, certainly, every week we still have people in this country that die of COVID. And, it's not as much as it was before, of course. But, and the flip side of that is, as the virus has continued to mutate down this Omicron family variants, it's just become, so much more contagious, more infectious.
Has it
And
become weaker, though, doctor? Or is it
well,
still...
weaker in the sense that it does not cause severe illness as much. I mean, very, very rarely do I see a patient that tests positive and they have also COVID pneumonia and they're hypoxic, their oxygen levels are low. Most of the time, what we see is just a very aggressive upper respiratory infection, sore throat, runny nose, weakness, lethargy, fatigue. Most of these patients go home. Those that are higher risk are prescribed Paxlovid, just to prevent the virus from progression to the point where it causes severe disease and hospitalization, requires them to come back to the ER. It's just much more contagious, and that's just normal viral evolution. Like the virus just doesn't want to be stamped out, and so it's just going to evolve to the point that, again, Darwinism, the most efficient variant that's able to spread from person to person is going to be the one that's going to persist and survive among all the other variants.
I just think about deadly illnesses that are associated with growing threats of pandemic. I mean, Ebola comes to mind, but there
Mhm.
are others. And I wonder about the disposition of this country now from a scientific standpoint with these guys in charge and with
Mhm.
essentially um, no disposition toward aggressively handling that from a vaccine standpoint. But this guy wants a 20-year double-blind study with a placebo group. That's not going to get you to
Yeah.
stop the bleeding if there's a pandemic of the sort that we saw with COVID. I mean, there we're as thorough as we can be, I would say, given what the best science says about the vaccines that we're developing. But this guy seems like he has no stomach for any of it.
Yeah, and if you look at the White House Office of Pandemic Preparedness, which was set up in 2020 with a staff of 20 people under Biden, now there's one guy, and nobody seems to know, what's going on. Like I read in some articles that he is tracking bird flu as a physician. I can't remember his name off the top of my head. But when you have an office like that, it's just been downgraded from 20 to 1. It just shows that it's not a priority for this administration, for RFK Jr., for HHS. And that's not just bird flu. It's like you mentioned, it's Ebola, it's other potential pandemics, just to be aware that we're living in an era where pandemics can happen. And like you said before, it's just we're just going backwards instead of being more prepared and being more forward and learning lessons from the previous pandemic.
It just seems like revisionist science and in such a science really has left the building. I don't even understand. I know they use a lot of scientific terms, but there are no real scientists involved. It wouldn't seem anymore. Even these doctors to whom we've referred in this conversation just seem to be all about total quackery. In our last few minutes, I want to step away from vaccines. I have a contemporary concern. I want to try to drop 10 pounds. It's amazing. People say, you look great, Mark. You're incredible. Look, I understand I'm insanely handsome and I look great. I have when I walk into a room, people just can't stop staring at how great, but I need to lose 10. What's happening is I get older and I don't change my lifestyle at all. And now everything I eat is sticking to me. And I think that is true with a lot of people who are watching as well. Is there any workaround? It seems like pharmaceuticals are beginning to come to my rescue, but you need a little more than losing 10 pounds if you want to get on that stuff that, whatever it's called, you can update me on the pharmaceuticals and then just give me the grim realities about how I have to get into the gym, move around, reduce the calorie intake. Give me 30 seconds on this.
Right. So I think the top three things that I would say you need to do. So the age old wisdom was always that doing a lot of cardio was the way to lose weight. And so when you're running on a treadmill at the gym, you're burning calories. But the moment you stop running, that burning stops. And when you look at multiple research studies, when you lift weights, you're burning calories during the weightlifting. You continue to burn even after you stop lifting for multiple hours. And so many studies have shown that if you lift, if you're doing strength training, you're going to burn more fat than just doing cardio alone. So that's the one thing I want people to remember. The second thing is you have to track your calories. MyFitnessPal, there's new AI apps that I was just learning about recently that if you're not sure how much protein, fat, and carbs are in your meal, you take a picture of it. It's just done so easily now that you can
Wow.
track,
Wow.
and you'd be really surprised to see what you consume during the day. And once you just take ownership of that and you can track it and you can get to the gym and lift some weights, and then of course sleep optimization. If you're not, we talked about this before, if you're not sleeping well, you're not going to build that muscle, you're not going to burn that fat. The growth hormone release that you need in the middle of the night is not going to happen, and that's so important for your metabolism.
It's pointed out here by Phineas, playing poker is not a sport, Mark. Yes, it's true. It is such a sedentary activity. That is true. Um, I also think, boy, those are really great tips, and I think that those are applicable. I mean, not only applicable from being relevant standpoint in the use of the word applicable, but I mean, I can apply those things. They are doable, you know.
Mhm.
So as usual, you have helped me and you've helped us, and I appreciate this visit. Did we leave anything out that we wanted to get to? I think we got to everything.
Oh yeah, the other one tip I love to give patients is, especially ones that are just starting to exercise and they want to burn fat and lose weight, is that the dinner meal, when you have dinner with your family and then you immediately either want to go sit on the couch and watch TV or movies, that is the best time to go for a walk, because like, just leave the dishes, eat, go for a walk. It'll help your metabolism. It helps insulin release. It'll just help you digest a little bit better. And that's time with your family. It's time outside. Go for a walk. That's where you burn a lot of fat, and everything
That's
that
a
you'll eat won't stick to you, as you mentioned. So
Yeah, great tip, and thank you for reminding me, because you did remind me of the last story that I wanted to ask you about, because the sitting on the couch watching TV and eating is the a stoner's manual, and there was just a new study, and it came out of San Francisco, and there are a couple of things about the study that are a little bit, to me, maybe thin.
mm,
One of which is the number of people involved in the study. It was just 55 people, but they found that the effect of cannabis, either marijuana intake, smoking, or marijuana intake with edibles, had an effect on the heart, a negative effect on the cardiovascular system. Can you speak to that? Because that is it's become a favorite pastime of mine
yeah, I think
and of many.
yeah, I think the shocking part of this is the edible part. I mean, we've known that smoking is bad, but to see that in those with heavy cannabis use in the study, whether it was from edibles or smoking, had a higher risk of endothelial damage. So just to remind our viewers, so the endothelial lining is the inner lining of our vessels, whether that's our heart, throughout our body and our brain. And so when you have damage to the inner lining, you're more likely to have plaque and clots stick to that. And those clots, that plaque, is the mechanism for heart attacks and strokes. And in particularly in the smokers in this study, they had a reduced amount of nitric oxide. And so nitric is so important for the dilation of the blood vessels, the response to blood pressure, systemic blood pressure, how our body responds to stress. And if you don't have that, you're increased risk of cardiovascular disease. And so I think because this study showed that those who smoke it and also those who use the edibles, I think it's the THC itself that's potentially causing this problem with the endothelial lining and the nitric oxide release and the increased risk of heart attacks and strokes, essentially. And so, like
That's
you said,
scary.
it's a
That's
small
scary.
study. It's a small study. Yep, you're right. But this wasn't the first study. There was another study a few months ago that we actually talked about on Fox, highlighting this. So I'll see if I can send it to you. But
Yeah, I'd like to read more. It's interesting to me. I mean, and then of course, there are all these examples. First of all, THC intake and smoking marijuana has been a part of the culture for decades and decades. I mean,
sure.
and you have like the poster child for it all, Willie Nelson, who's, what is he, 90 or something? I mean, he's got to be closing in on 90. So it clearly isn't a death sentence, but and has brought a lot of relief and pleasure to many people.
Mhm.
But it was a radically alarming thing to read, that even if you avoid smoking, that it might have an effect on your heart. So thank
Mhm.
you for the breakdown on that.
Sure.
Well, our time is done, but this has been great. You can find Dr. Daignault on Fox 11 in Los Angeles. He does regular reports there, and here every couple of weeks with Vital Signs. Thank you, Dr. Daignault. Appreciate it
Thank
a
you for
lot.
having me. Good to see
All
you,
right.
Mark.
Yeah, good to see you too. That's Vital Signs for today. Hi, it's
Check
Mark,
your-
and I thought that was great. Hit the notification bell. You'll know whenever there's a new video being dropped, and please subscribe to our channel to help us save the universe.